Right, thank you for staying with Daybreak. So let's cross over to Nakuru. It's one of the counties that has been marked as a hotspot. So far has about 5 COVID-19 cases. And joining me now live from Nakuru is the governor, Kinyanjui. Thank you so much for making time for us, Governor. So the concern that many people have is Nakuru has recorded 5 cases of COVID-19. What plans do you have to ensure that it doesn't spread that fast in your region?
Okay, I think the first point is to clarify that we do not have 5 cases, and that we actually have 2 cases that are being treated here, but we had 2 persons who had traveled out of the country, and when they came back, they were quarantined in Nairobi and are actually being treated from Nairobi. So it is true that their ID will read they come from Nakuru, but essentially they are being treated. So from a treatment perspective, we only have 2 patients. And the other one that was being reported as a 5th patient was actually the same 2 patients we had after 12 days. It is routine to go and test the same the confirmed case to see whether they have changed their status. So in essence, we only have 2 cases.
Okay. But in terms of preparations, how have you prepared? How many ICU beds do you have? PPEs, medics, how many have you hired so far?
Okay, thank you. So first, in terms of training, because I think that's the start of this whole conversation, we have trained over 1,400 health workers, and this exercise is ongoing because we believe that for purposes of preparedness, we need to enhance the healthcare worker, which is really our first point of contact. So it should be really emphasized that training and also equipping of our healthcare workers remains a big thing. So as a county, we have invested heavily on equipping of our healthcare workers, starting with the PPEs. In the last supplementary budget, we've included about 167 million shillings that will go towards the support of this particular area. We have about 19 ICU beds currently, and we are investing in an additional 4. And also working in collaboration with other private hospitals, because as you can imagine, the issue of fighting the COVID-19 must be a collaboration between government and non-government organizations. So we also have partnerships with private hospitals that are also working to ensure that we have a better response uptake. Lastly, also, is to say that in our continuous engagement, we also have a coordination with all hospitals working within the county, so that for detection and also treatment, there's a well-coordinated approach. And lastly, also, is to say in the public health arena, the first line of defense is the area of prevention, and therefore we are working to ensure that at all our entry points, in all our public areas, especially the hotels, we train the hotel owners and keepers over a month and a half ago, because this is really where any visitor or traveler will come for the first time. So we've trained our hotel, especially the front office people, to identify when these people come, and if there's any possibility of any signs, then we can collaborate. And we found that to be very effective in the management. Lastly, on the public health front, we have an elaborate contact tracing. Once a suspect has been confirmed to be positive, the most important thing is to trace back all the contacts they have had within the last 10 or so days. And therefore, effective management lies on how well we can be able to get these contacts, quarantine them. Those who are able to cooperate, we work with them. And then those who are defiant, we make sure that they are under a forced quarantine to ensure that there is no non-compliance, as it were. So I think we are working together. And I must also say the public also plays a very huge role, because they are the people who call us and oftentimes talk about those who are not complying with the quarantine, tell us about a new visitor in the village or in whatever hotel, and so on and so forth. So again, the other area where we really need to work is to ensure that the public is also in the forefront in ensuring that the information that is necessary in the management of COVID is adequately forwarded.
How many medics have you employed so far, Governor?
We are, other than what we already have, we have 312 that are currently under the recruitment process, and we are planning to get another 100 or so on short-term basis to man some of those quarantine centers and to ensure that during this period we do not have a shortfall. However, I must say, given where we are right now, other than the normal shortage that we have, we would say that we are not overly stretched and we are able to manage at where we are. But so far, we are recruiting 312 healthcare workers.
Is there a plan to increase maybe their risk allowances as the frontline workers?
I think that's an ongoing conversation, but maybe what we really would want to say is that given the increasing burden for healthcare, starting with the management of COVID is very expensive. The protective clothing you require is very high, and no county had budgeted for some of these things. So we are already in discussions to see how we can be able to deal with this. And the reality is that even in a small rural place within Nakuru, a health center, although they've not had COVID as such, the reality is that in terms of preparedness, they are all on high alert. So sometimes it may not be very easy to isolate exactly who is dealing with the COVID and who is not dealing with it, but we will be able to come up with a mechanism to ensure that we reward them. But I think for us, we see motivation and reward beyond just the COVID period. The motivation of our healthcare workers is a long-term thing, and we have structures and mechanisms, including promotions, that we have been following for the last 2.5 years.
How much have you put aside to deal with COVID-19, Governor?
In the supplementary budget that we passed about a week ago, it's a total of 167 million shillings that will go towards additional PPEs to see how we can expand. We want to add some 4 ICU beds and such like activities and operations that may be necessary for purposes of screening at our entry points and so on and so forth. So a total of 167 million shillings. It's certainly not sufficient, but I think it's a good start. And for now, I must say that we have a good start. We have what it takes for us to deal with this disease at the current numbers. And I think that's why we've been trying to emphasize that the devil is in ensuring that the numbers do not escalate beyond a point where we can have maybe need for 100 beds of ICU at a go and so on and so forth. So we really want to encourage that the area that requires utmost focus and also investment is in the area of prevention, because it is, when you say that about 5% of the patients will require ICU bed, then you would really have to look at, if you had 1,000, 2,000, what's the 5% of that, and can you be able to get it? So I think the real conversation must be in the area of prevention, because no matter what we do, not even the most developed nations have all faced the problem of shortage of all these things. So we'll do the best we can, but we really want to emphasize that more focus must go towards prevention.
Yeah.
And I must say, for now, looking at some of them, the interventions we have made, including not traveling to Nairobi and other areas where some of these confirmations have been made, has really helped us in a big way to ensure that the infections are not as high as they should be. So I think we really want to focus on prevention. So even in terms of our budgeting, part of that money must go towards the public health information, public health awareness, and also enforcement, because we see a lot of people in border and small trading areas, somehow the perception that maybe this disease hasn't reached the rural areas, that is a perception that we must all fight and ensure that everybody appreciates that the disease can travel far and wide and deep into our villages.
Governor, what is the plan to cushion the people of Nakuru should this situation escalate in terms of food? Do you know the most vulnerable in Nakuru, and is there a plan to distribute food to them should the situation escalate?
Well, yeah, about last week we had a meeting with some of the stakeholders in the charity sector, some of them like Red Cross and others, because we are really trying to test our systems. Although we hope for the best, we are aware that things don't always go as we plan. And therefore, as a county, one, we have allocated specific resources to go towards questioning the poor of the poor. And I must clarify that the poor here are not the rural poor, because the rural poor may be poor, but they have food because they have farming and so on and so forth. So for those who may be in rural areas, our intervention may be in terms of availing water, accessing, cleaning, how you can clean your hands, and so on and so forth. So our major challenge would be in cushioning the urban poor, especially those who are employed in sectors that have since closed, like the flower business, the rose business in Naivasha. We have very many flower farms. That really would be our first thing. Or also urban centers, where you have people who rely on manual work. So you go in the morning, you're paid in the evening, and you buy your food. So since that job has closed, you do not have money anymore. So for the urban poor, that would really be our main focus. For the rural areas, our intervention would be more to ensuring that they have access to cleaning hands and so on and so forth. So our focus will depend on where we are, because as you can imagine, Nakuru is diverse. We have the most agricultural places, we have industrial places, we have urban or urban slums for that matter. So we want to tailor our response to match the needs of this. And like I probably have mentioned before, we have already done a baseline survey to indicate the most needy areas, and they are already mapping that with a view to now getting the process started. It's also important to note that as a county, we may not be able to do everything. Therefore, we have sought partnerships. We'll be working with the Rotary groups that may want to come and partner in fundraising, in distribution, and so on and so forth. Red Cross, the same. We have had the Hindu Council come forward. We've had the Nakuru Business Association, the Chamber of Commerce, and many of these other organizations that also feel that they have an opportunity to participate in cushioning the lower segments of our society.
So, Governor, when you talk of the urban poor, what is the plan there? Are you going to give cash transfers? What's the plan?
For the urban poor, I think we are still yet to crack it, but I think what we are doing is, once you have screened the people using the MCA, really everybody, every home, every corner. We also have what you call the chief. You have other grassroots leadership structures. So they do the mapping, they come up with the names that would be considered the poorest, because at any one time, if you went to a place and just said anybody who wants food come, that will probably never work. So then once you've done the mapping, for those who are close to the very urban centers, we are trying to work with some of the big retail centers so that we can have a voucher system. So once they are mapped, you give them a voucher, then they can walk to a shop and probably get whatever equivalent to that voucher. But for those, because we don't also want them to incur transport and again a lot of movement, the right thing would be for those who are vetted, they're informed the day to come to the chief or the school, wherever that is, and in an orderly and COVID-conscious way, we can be able to distribute the food. We have already started that in our career in Naivasha, and I must say, working with the local leadership together with the DCC, the county commissioner, and everybody, the response was overwhelming. The only difference is that before you do the actual distribution, you need about 2 to 3 days for preparation and security and everything. So I think the issue is in ensuring that before you do the actual presentation, you have done adequate preparation. And I must also say that we want to really comply with the national government regulations, that for private people who may feel philanthropic and just go to the stores and buy food and take there, the results may not be very good. So we really want to have a structure. And it is for that reason that we have enjoined Red Cross and all these other charity organizations that can help us increase our logistics. We also have a plan to come up with a command center so that anybody who may want also to drop a few sacks of unga and so on and so forth, they have a platform that they can do this. So again, all these things will be done in consultation with the private sector, with the wananchi and everybody, and I think at the right time we'll be able to announce all this, because the structure in distribution of food becomes also very important. If you don't have a proper structure, you may end up overfeeding one slum while another one goes hungry. So coordination becomes very critical for information gathering, and also for ensuring that we have a good continuity in the program.
All right. Governor, thank you so much for making time for us this morning, and all the best as you deal with COVID-19 in Nakuru. There, Governor Kinyanjui speaking to us live from Nakuru on his preparedness for dealing with COVID-19. 167 million, he says, has been put aside, and also they have 191 ICU beds also, as they look for more to ensure that they deal with COVID-19.